Hello, my name is Rachel Wood, and I'm back for some more Medicare education. Recently, WPS has received questions regarding the new updates to the local coverage determination, LCD L38841 for Facet Joint Injections. This video will cover what Facet Joint Injections are, coverage guidance, define terms and types of injections, documentation requirements, and review examples of frequency limitations. So what are Facet Joint Injections? This is a general term used to describe the injections of local anesthetic and possibly a corticosteroid in the facet joint capsule and along the medial branch nerve supplying the facet joint. Facet joint interventions may be used in pain management for chronic cervical, thoracic, and back pain arising from the paravertebral facet joints. Current resources from CMS and WPS on these injections include Article A58477, Article for Billing and Coding, Facet Joint Interventions for Pain Management. This includes information on documentation requirements and billing for these procedures. Review the LCD L38841 for information of reasonable and necessary requirements and frequency limitations. Information in this video is summarized from both of these resources. Now let's move on to coverage guidelines. Facet joint interventions are considered medically reasonable and necessary for the diagnosis and treatment of chronic pain in patients who meet all of the following criteria. The patient has moderate to severe chronic neck or low back pain causing functional deficit measured on a pain or disability scale. Pain has been present for 3 or more months with documented failure to non-invasive management. There's an absence of untreated radiculopathy or neurogenic claudication. And there is no non-facet issue per clinical assessment or radiology study that could otherwise explain the source of the patient's pain. Pain assessments must be performed and documented at baseline, after each diagnostic procedure, and at each follow-up using the same pain scale for each assessment. Obtain a disability scale at baseline as well, used to assess the functional ability of the patient if the patient qualifies for treatment after the diagnostic injections. There are 4 types of injections that the LCD discusses. These include diagnostic facet joint procedures, therapeutic facet joint procedures, facet joint denervation, and facet cyst aspiration or rupture. First, let's define some key terms used in this LCD. Medicare defines a treatment session as a time period which includes all procedures performed during one day. Next, regions in the policy are divided into 2. The cervical thoracic region and the lumbar sacral region. These are then divided into a left and a right side. Okay, let's first look at diagnostic facet joint procedures. These would be either intra-articular injections or medial branch blocks. For the initial injection to be medically necessary, the criteria outlined in the policy must be met. Note the intra-articular injections are considered reasonable and necessary only if the medial branch blocks cannot be performed. Complete second diagnostic injections within 2 weeks of the initial injections. Document that the patient met the criteria for the first injection, and the first injection provided consistent positive response of at least 80% relief of primary pain. For each 12-month period, no more than 4 diagnostic injection sessions will be reimbursed. This is in recognition that the source of pain may not always be identified with the first 2 injections. The goal of the diagnostic injections should be to progress to therapeutic injection when diagnostic criteria is met. For therapeutic injections, document that the patient has completed 2 diagnostic injections with 80% or greater pain relief. Submit documentation that the patient is not a candidate for radiofrequency ablation if proceeding with therapeutic injections. Subsequent injections in the same anatomical site should sustain pain relief for at least 3 months or give 50% overall improvement. For each covered spinal region, no more than 4 therapeutic facet joint sessions will be reimbursed per rolling 12 months. Now let's move to facet joint denervation. This includes thermal radiofrequency ablations. Document that the patient has had at least 2 diagnostic medial branch blocks, again with 80% sustained pain relief. Repeat RFAs at the same anatomic site if the patient has had sustained pain relief of 50% for at least 6 months or has had 50% consistent improvement in ability to perform previously painful movements. For each covered spinal region, no more than 2 radiofrequency sessions will be reimbursed per rolling 12 months. Now that we have reviewed what these injections are and some policy-specific guidelines, let's look at some examples of how frequency limitations would be applied. Example 1. The provider wants to give a radiofrequency ablation in the same region, but is unsure of the correct way to apply the frequency limitations in the current LCD. As previously mentioned, the LCD divides regions into the cervical thoracic region and the lumbar sacral region. These are divided into the left and the right side. Medicare covers the RFAs if the provider performs the RFA in one region and gives us another RFA on the opposite side. Medicare does not consider this to be the same anatomical site. If the provider performs a second RFA on the opposite side in the same region, the frequency limitation of 2 injections in a 12-month period have been met. An example of this would be giving an injection in the left lumbar sacral site, followed by a second injection in the right lumbar sacral site. Example 2. The provider wants to give 4 diagnostic medial branch blocks and 4 therapeutic medial branch blocks in a rolling 12-month period. Is this okay? While the policy does allow for 4 diagnostic medial branch blocks and 4 therapeutic medial branch blocks in a rolling 12-month period, we would typically expect the goal of the diagnostic injections to be moving to RFAs as a primary treatment goal. Typically, the patient would receive 2 diagnostic injections followed by 4 therapeutic injections or 2 sessions of RFAs in the first year. In subsequent years, assuming the medical criteria for continued injections continues to be met, Medicare limits the patients to 2 sessions for RFAs or 4 sessions for therapeutic injection. Please note that the patient cannot receive 4 diagnostic injections, 4 therapeutic injections, and 2 RFAs in a rolling 12-month period. This concludes this video on facet joint injections. Please check out WPSGHA.com for additional information on this topic, as well as a list of frequently asked questions and answers. I hope you found this video helpful. If so, please like and share this video, and don't forget to also subscribe to our channel.